Hello everyone, myself Mansi Bhatia and today I'm going to represent about otitis media. So let's start. First of all, what is otitis media? Otitis media is an infection or inflammation of the middle ear in which the air-filled space behind the eardrum that contains the tiny bones of the ear, that is ossicles. Common in children, but it can affect all the ages. Often result from the cause or respiratory infection. Here, the normal and ear anatomy would be there. That is three parts were there: outer ear, middle ear, and inner ear. Here, the infection would be there in the middle ear. Okay, as you can see in this picture that the middle, in which the inflammation and swelling of canal will be there. That is known as otitis media. Now, types of otitis media, there are total 5 types, that is secretory otitis media, chronic adhesive, aero-otitis media, tuberculous otitis media, and syphilic otitis media. So let's begin with the first type, that is secretory otitis media, also known as silent otitis media, serous otitis media, glue ear otitis media with effusion. It affects the age between 2 to 7 years of a child, mostly in spring and winter month. And there is pressure of sterile effusion, which is usually thin but which is become thick and sticky, is known as glue ear. Now, the etiology for the secretory otitis media would be allergy of nose and upper respiratory tract, recurrent viral infections, barotrauma, eustachian tube dysfunction. These all can lead to otitis media and resolved acute otitis media due to inadequate antibiotics. Now, the symptoms are periodic deafness of conductive type, plugged up feeling in the ear would be there. Autophony and tinnitus, mild earache, delayed and defective speech would be there, may be asymptomatic also. Now, the treatment for this is medical management is decongestant. We can give anti-allergic and antibiotics we can give. Middle ear erosion is promoted by Valsalva, and chewing gum exercise also help in opening the eustachian tube. Now, the second one is chronic adhesive otitis media, in which adhesions have developed as a result of previous inflammation. For this condition to develop, it is necessary that a brainous exudate must form and stay in the middle ear for the long time. It occurs bilaterally and develops some secretory type. One type can lead to chronic adhesive otitis media. The symptoms are deafness of conductive type and history of discharge from the ear. The treatment will be hearing aids will be then in chronic and no other treatment will be work. After that, the third one is otitis media, in which due to the dysfunction of eustachian tube resulting in inability to maintain the middle ear pressure, usually caused in which one is traveling in an aeroplane. The third one is aero-otitis media, in which due to dysfunction of eustachian tube resulting in inability to maintain the middle ear pressure, usually caused in which the traveling in an aeroplane with rapid descent taking place, and when one is doing under the water diving or during compression in pressure chambers. The clinical features for aero-otitis media are severe earache, tinnitus, vertigo, effusion on middle ear, conductive type of hearing loss would be there. Now, the treatment, middle ear ventilation should be restored by decongestant. We can give the medications like decongestant. Okay, precautions should be taken by avoiding traveling during upper respiratory catheters, avoiding sleeping during descent. Vasalva chewing gum exercise would be given. Now, the fourth one is tuberculous otitis media, usually seen secondary to pulmonary tuberculosis, when the tuberculous bacilli find their way through eustachian tube, which lead to tuberculosis otitis media. Here, the multiple perforations of tympanic membrane would be there, may join to form a big perforation. Okay, this is painless yellow granulation tissue not responding to usual treatment. Treatment for this is antitubercular therapy would be given. Rifampicin, streptomycin, isoniazid, and para-amino salicylate will be given. Now, the fifth one is syphilitic otitis media, seen secondary to syphilis of nose and nasopharyngeal, where the treponema find their way through extension tube into the middle ear. Necrosis and otitis of a bone occurs, causing foul-smelling discharge and perforation. Treatment: large dose of penicillin would be given. Now, chronic suppurative otitis media, it means chronic or long-standing infection of a middle ear tuft, which is characterized by discharge, deafness, and a perforation of a tympanic membrane. This is the most common case of deafness in the country. Right? Now, two types were there: tubotympanic and antiquater, or safe type of unsafe type. Okay. Now the examination is done by the Veni negatives and Weber lateralized to bad ear, and treatment for these are antibiotics and surgery would be given. Now causes and risk factor. Causes are bacterial and viral, in which streptococcus pneumoniae and viral infection like influenza can lead to the otitis media. Now the risk factors are from age to 6 to 24 months, exposure to tobacco smoke, daycare attendance, and water feeding. Now, diagnosis would be done with physical examination, pneumatic otoscopy, and tympanometry. And now, for that, we can give PT management, in which short or diathermy position of patient's spine and sideline will be given. And position of electrode would be placed drum electrode over the ear that is affected, and place towel between the ear and electrode. Place the other electrode on the other side. Like this, we can give short or diathermy. Complications for the otitis media would be hearing loss, tympanic membrane perforation, mastocytitis, colostoma, speech or development delay. Now, what are the preventions? Preventions are breastfeeding, avoiding tobacco smoking and exposure, vaccination, hand hygiene, and reducing pacifier use after 6 months. This is all about the otitis media. Thank you.